Hello, everyone. We are going to kick off on time here, but folks are still trickling in. Good afternoon, and welcome to the third and final webinar of our series, Cultural Mental Health Services Through the Lifespan, hosted by the Progreso Latino Fund. My name is Gypsy Garcia, and I'm a member of the Progreso Latino Fund Advisory Committee. If you missed any of our previous webinars on adults and children, you could view them on the Community Foundation's Progreso Latino Fund's website. I'm going to briefly provide some background on our fund, some tech reminders, and then I'll introduce our panel moderator. The Progreso Latino Fund, a component fund of the Community Foundation, is in its 20th year of inspiring Latine philanthropy in our community. To celebrate, the fund is distributing an unprecedented $100,000 in grants over 2 years, addressing the most pressing issues facing Latinas today. We have introduced the 20th anniversary match campaign to grow the Progreso Latino Fund and increase its impact. We will match any gift to the fund dollar for dollar up to $2,000. Please consider a donation by going to the Community Foundation's website. Before we start, please use the Q&A function at the bottom of your screen to ask questions during the program. If you have issues with your connection, please use the chat function. At the end of the program, you will see a survey pop up on your screen. Please take a few minutes to give us feedback, which helps us to continue planning quality programs. One of the pressing issues we chose to focus on this year is mental health. Cultural stigmas and social taboos make mental health difficult, creating barriers to seeking treatment and leaving communities vulnerable to mental health issues. Our Latina community is far more likely to face these barriers and inadequate access to treatment services. Today, our speakers are addressing affordability, access, cultural appropriateness, and education on the benefits of seeking treatment for our senior population. It is my pleasure to introduce our moderator today, Frances Padilla. Frances Padilla is the recent past president of Universal Healthcare Foundation of Connecticut, where she served in various leadership roles since 2004 and as president from 2012 to 2023. Thank you, Frances.
My pleasure. So happy to be here today. Thank you, Gypsy. So glad to be moderating this third forum on this important issue of mental health and well-being in the Latina community. It is such a complex and deep issue that back in 2022, when the advisory committee hosted the very first webinar, we all came back and said, you know, this needs to be a series. And so here we are, having talked about children, adults, and now older adults. So I want to welcome onto the screen our panelists today, Dr. Francisco Lopez and Leonora C. Rodriguez. Would you please join me on the screen? And I will introduce you in a little more depth. Dr. Francisco Lopez is a clinical and forensic psychologist in private practice. He specializes in psychological assessment and treatment, as well as conducting forensic evaluations. He holds a part-time faculty appointment at assistant clinical professor at Yale School of Medicine, where he supervises interns within the Hispanic Clinic, Center for Mental Health, the Connecticut Mental Health Center's inpatient unit, and the Behavioral Medicine Assessment Clinic. He's also a former staff psychologist at Fairhaven Community Health Center. He serves on the board of the Spanish community of Wallingford, a community-based organization serving the Wallingford and Meriden area. So welcome, Francisco. So happy to have you here today. Thank you. And I'd like to introduce Leonora C. Rodriguez. Leonora is a social gerontologist and executive director of the Milford Senior Center. She is she focuses there on social aspects of community-based aging, creativity as a coping tool for older adults, and healthy aging and conscientious living. She is a mental health first aid trainer and facilitator for the Montreal Cognitive Assessment for the Detection of Dementia. She is also a visual artist and has been one for more than 30 years. So welcome to you, Leonora. Thank you as well. And let's kick off this conversation. I invite our attendees, our participants, to post your questions in the Q&A. It helps to stick to the Q&A rather than the chat, because that way I won't miss anybody's questions. But this is going to be a conversation about some critical issues in this area of mental health. And we are going to talk among ourselves, but we want to pull you, the audience, in through your questions. So let's start. I would love if you would each take a few minutes and reflect on what you've learned from working with older adults, and specifically those of Latine origin and heritage. Would you like to start, Francisco?
Sure. So thanks for having us here. I think this is an incredibly important topic, mental health in general, but specifically focusing on the older population. And so in my work, I do a fair amount of evaluations and a fair amount of therapy among older adults. And a few of the things that often people are referred to me for are, and I think this is probably obvious, is just cognitive decline, right? But what I see mostly in therapy when I'm meeting with individuals is a little bit more nuance. And this tends to be around existential issues. And so things about sort of end of life conversations with families, questions about faith, questions about, in particular, our Latino population. Do I return back to my home country and retire there, or live out the rest of my life there? Intimacy and sexual functioning is a big one, as well as devalued social roles. So this idea of, I was a pretty functional member of society. As I'm getting older, I'm not viewed as valued as I once was. And so those are some of the things that I'm seeing that contribute to anxiety, to depression, and there's more that I think we'll be able to get into in this conversation.
Yeah, thank you. We'll come back in. Did you want to add anything to that?
I think the only thing I want to add is that it becomes even more unique with newcomers, elderly individuals, older individuals who are newcomers to the United States and are navigating the system.
Thank you. We'll return to these themes that you've laid out for us in the conversation for sure. Leonora, how would you like to reflect on what you've learned as you work with older adults?
Sure. So I've worked now with older adults for 20 years. I started in a nursing home as a recreational therapist. And I found the changes of life and medically that brought a person to live in a nursing home really just focused on that medical aspect of that person. And we're just more than a diagnosis. We're people who had this full life, and suddenly changes occurred that we're no longer able to stay at home. We are in need of 24-hour care, but that does not take away our personhood. So for myself, it's really making sure that that person was connected, and those caregivers around were also cognizant of that, that they're not just a person on their roster to take care of. It is a person who had a full career, a full life, a family, who can still give, but in a different capacity. Moving from nursing homes to assisted living to adult day program. And now as the executive director of the Milford Senior Center, seeing folks in the community, I'm looking at the spectrum kind of change from our oldest folks that I met in the nursing homes to younger, older adults. So when I'm talking about older adults, I mean, there's three general groups. It's 65 to 74, 75 to 84, and then 85 plus. So those groups are very different from each other, and their needs are going to change as they enter each segment of their life. And really, as we age, aging is just part of it. What is not part of it is really when we are experiencing severe or chronic mental health concerns. That's where the community-based supports that where I am now in the senior center is helpful, so that there's building blocks for themselves and their families if and when they need additional care that may bring them into a long-term care environment. So I like to talk about how we can continue enriching our lives.
Continue enriching our lives. That's right. Continue the journey that our entire life is. Well, you both have alluded to something that I appreciate, Leonora, you breaking down the age categories, and our participants might notice that you started to use the word elderly, Francisco, and then corrected yourself and said older adult. And you have helped me also recognize that there's a real difference, but I think it's nuanced, and it would be a good way to get started if you would reflect on what the current thinking is about elderly versus older adult.
Yeah, so we have to be mindful of language. Anything that denotes either discrimination, that denotes that the person has an inability to live a fruitful life or be a valued member of society due to their age. And so terms like seniors, elderly, aging dependents, we do want to stay away from them and use terms like older adults, older people, older individuals, the older population. And like Leonora mentioned, we're usually talking about individuals that are 65 years and older. But even within that, we know individuals who suffer from mental illness, the functional impairments that older individuals face may actually come earlier when you have a mental illness. And so even though older individuals 65 and over experience some of these things can occur much sooner, depending on their mental illness.
And yes, and well, let's talk then a bit about the issues of people coming to this country from other countries in their older years, right? Some people have come in before 65, and some people get here around that age, around 65 or older. What are some of the particular issues that they experience?
So I think the biggest one is just resettlement stress. And so this has to do with you're coming into a new country, and well, how do I secure housing, healthcare? How do I manage my finances? With whom do I live? Do I have choice as to with whom do I live? So meeting basic needs, which are not unique to newcomers, but it adds an extra layer of stress, especially if you don't speak the language. From a mental health perspective, the other is the stigma, and so there could be a dichotomous view between wellness and illness, and so we're either fully well, and if we are experiencing symptoms of depression, then maybe we're viewed as that there's something wrong with me. Older adults are also more likely to seek out religious leaders to talk about concerns about wellness and mental health. So they may not necessarily view a psychologist or a counselor or a therapist as the first line of treatment for them. So those are just some of the concerns. The other is just trust in this new system. Especially if you're coming from a country that has not taken good care of their older population, or of individuals with mental illness, that they may just not trust us as well.
Yeah, which is, of course, a theme that prevails across the lifespan in terms of stigma and trust. Leonora, as a person who works in the community, right? And how does this issue of resettlement and that sort of feeling unsettled show up in the community environment?
Truly, It's about your social connections. And if you're moving from one place to another, whether it's another country or another town or another state, to be honest.
Or from one apartment to another.
Yeah, you're from one place, from A to B,
Right.
from this street to that street, to be honest. It's your social supports. It's the breakdown of your established social supports.
Yeah.
So if you always went to the same church, let's say, I like to use my mom as an example always, but if my mom's Catholic, she goes to Catholic church. If suddenly that church is no longer available for her in her community, and she has to go to another Catholic church, she would still have to recreate these social supports that were built in from her friends, from the folks, the congregants in the church, even the spiritual leader there. So it's rebuilding of trust that is often a challenge when a person is trying to resettle in the place. So for professionals, it's the gaining of rapport and making that person know that, hey, you have someone on your team. I know this is a brand new team that you're on, but I'm right here. I'm part of the team. I'm your cheerleader. I'm your coach. I'll be whatever you need, but we're going to get you where you need to be. So that's what that community and that social support really is.
So that's one of the critical needs, social supports. I love the idea of a coach, right? Of having somebody, whether it's a member of your family or of the church, or in a senior center or somewhere else, but having someone connected to you that helps you make the connections you need to make. Yeah.
I also think, validating, if they are in a religious or a faith group, validating for them what their pastor or their community members are saying in terms of what's good for their health. And if you find, I think as a clinician, if I find like, yeah, that's good. How do we then enhance that for them? And so to say, we're in a way we are partnering with these community leaders who are really gatekeepers to us. That if we can validate that for them, I think it could be. It's worthwhile.
Yeah. So I think before I continue, someone asked whether this program could be in Spanish, and because it would help the folks that some of the folks that are on the program. We didn't anticipate carrying this conversation out in Spanish. So we're going to continue in English, and I apologize to the person who requested that. This is something, note to selves, which we will take up later. I apologize for that, but I did want to acknowledge the request. So I want to go on to, we're going to run out of time. I know that for sure. There's a lot to discuss here, but I want to go on to the notion of the value that people feel they lose as we get older. Both of you have alluded to that. And Leonora, can you talk a bit about how folks experience that, and then how we can keep people feeling valued?
Sure. As an artist, I always look at the creative aspects that we can engage. I find when you engage in art, you can do it on your own, and you can have a sense of something that is yours that you can complete, or you can segment time for. I also find that when someone then shares your art, and you get that instant kind of gratification of, oh, wow, you did this? I can't believe that you did this, or wow, that's beautiful. How long have you been doing this? Or whatever that conversation that strikes from the person, it starts to kind of bring that person up. The self-esteem, the feeling of that connection that I'm going to continue to talk about starts to grow in that person. For a lot of folks, the loss of work and loss of family responsibilities. So if you're a mother, a father, all these years, your kids are now grown, they're successful, they're raising their families, they provide you these wonderful grandchildren and everything. And suddenly, pues, mama está por ahí, like mom's over there in the corner, she's doing her thing, but she may not be getting on. She might not be actually part of the conversation. People can be whizzing around her doing their things, but mom is still right there, but mom is not actively mom. Now saying that, I respect my mom dearly. I love my mom. She's mom. I'll listen to her for everything. But it is important for her to have something that is hers that she can do that gives her that value. My mother volunteers at the soup kitchen. She's been volunteering since my father became ill and had some long-term health issues. And at first it was really a way to get her mind, out of that all the time of illness and caring to something that was hers. She picked up a paper from the other day that of a luncheon from when she first started. She said, wow, I can't believe I've been volunteering here for like 11 or 12 years already. And she tells me these stories. She tells me how she helps people, how they say, God bless you to her. She tells me that she serves over 150 people their lunches. And she does this one day a week. But that one day is so gratifying for her that she'll talk to us about it. And she brings in other seniors. She brings other older adults and friends and say, mira, niña, let's go and volunteer. It takes us a couple hours. You're just going to do a couple of things. And then she brings someone else into it and another. And my mother has become a leader in her age. My mother's 80 years old and she's a leader of her soup kitchen as a volunteer.
And so it puts fuel in her tank.
What's that?
It puts fuel in her tank.
Yeah, absolutely. My mom is really like, go, go, go. And it makes me so happy to see her this way. And I love listening to her because it's something that I don't hear from all of the older adults I work with. A lot of them are coming here to the senior center so that they can find purpose in life after retirement or after child rearing, grandchildren rearing years, something for themselves. I have so many folks who have joined our art classes, have become painters and are exhibiting their work and saying, wow, I would have never thought I would ever have my work shown. And now not only are they creating, but they're selling their artwork. So there's a lot to, a lot to be able to do after that. It's just really guiding that person and giving them, allowing the doors to open for them, but also maybe throwing in the key, jiggling it around a little bit and cracking it open for them. They may not know that necessarily that door is open and available for them.
So I want to take this in I'm going to stay with this issue, but I want to come back to Francisco. You are seeing folks in private practice or in group therapy, perhaps, right? And you're noticing that this devalued role or devaluing of their roles is a contributing factor to whatever they're feeling. And then Leonora is working in the community in a senior center context, but there's other kinds of contexts as well, right? So what happens for you, Francisco, when you're working with folks and you realize, this person needs fuel in their tank? Where do you send? What do you do? How do you refer?
Yeah, similarly. So I think, exactly, Leonora. Like it's true. So it's to Leonora because there's layers of devaluing or marginalities. Maybe is another way of saying it, is that. So it is social roles. So I'm no longer a parent, or I'm no longer parenting in the way that I'm always a parent, right? But not parenting in the way that I used to parent. And so that's one layer. The other is finances or working in purpose. That's another layer. Loneliness is another layer. And so we then become, or I become, putting on my social work hat and looking for programs and opportunities to refer these individuals to, and also working a lot with the family members. They become an important aspect of treatment and intervention, because it doesn't happen inside the office. If this individual is experiencing loneliness, sitting in my office for 45 minutes to 60 minutes a week is not going to fix their loneliness. We need to get them in a community or in programs like Leonora's, where they can be, they can meet people, they can engage in some activity, and that structure also just helps with their day-to-day functioning as well.
You did mention when we were preparing for today that group therapy functions pretty well for the older population.
Absolutely.
And
Absolutely.
As opposed to one-on-one, and there's the stigma, the trust, and all of that. But then there's also in a group setting some more community, right? like a sense of
There's community. They share information there, and then they meet outside of group and continue to throughout the week to continue to support each other.
So I'm going to ask you now about the issues around functional impairments, and we all know about the activities of daily living, just being able to take care of your own cooking and your own housework and, laundry, that sort of thing. But there's also sexual health, and, older adults don't stop being sexual beings, right? None of us, we live through an entire lifetime. So can you reflect a little bit more on that?
Yeah, so it really comes down to yes, so sexual health and then intimacy. And so so for some folks, it's they want to still be sexually active. They still want to date. And if they're married, it's helping within the relationship, helping individuals learn, well, how can we be intimate? And then how can we plan to also be sexually active? And so it requires a little bit more planning and maybe in some respects less spontaneity, but it's helping folks relearn or learn new ways to be sexual and to be intimate. And it's a huge part of the work that I do with older couples.
It's interesting. It's it goes back to the loneliness factor and the need for connection. And older couples may have never really had a sex life that gave them that, address those issues either. So as you age, it gets more complicated.
Right, and especially when if they're on their their second marriage or they're reconnecting, it's well, what are my preferences? What is it that I enjoy? What choice? I actually have choice for the first time. I have choice as to what I want and what I believe is important for me in my own body. Yeah.
Leonora, do you have anything to add to that?
Well, right before we started, I had one of our members here who has been chatting with me about the loss of their spouse. And the reason for coming to a senior center was to find someone. The person said, I am single and I am ready to mingle. And although that is not exactly what we do, it is a place where people can find others. And I have seen successful partnerships develop here, starting off with a friendship to having someone say, oh, we're boyfriend and girlfriend now, ha ha ha, at my age, and I think it's kind of, I think it's something wonderful when a person is able to find someone that that has this lived experience, possibly similar to their own, that is ready to engage in this different type of intimacy, as Dr. Lopez has said, that it is by a choice that they now have versus what they may have had at an earlier earlier age. It's what makes sense for my life now. And I often hear, oh, our children are going to meet. And I'm very excited about that. Or, we just went out for lunch and it was wonderful. It was so nice to have someone to talk to about things that we can relate to. And those are the parts that people don't always see in the senior center role, because a lot of time people kind of see a senior center as a place for lunch and bingo. But bingo, we also take care of some other things as well. It's that seeing where a person is going from loneliness to companionship. And that is such a beautiful thing to have at any age, and especially as we age, to continue to have the autonomy of being able to choose a partner, to choose who we spend these days with, our minutes with, our love with, and everything. So it's I in my past working out of kind of bring this back a little bit. My past working in a nursing home, when we had folks that wanted to have more of a sexual intimacy, it is something that we have always called in for our doctors to come in and interview our social services, because they want to ensure safety and understanding, and ensure that there's nothing that may be a contributing factor that can pose a challenge for that individual. And there's a lot of things that can come on the medical side of it, but also the psychological side of it. So they really want to make sure that person is ready for that in every which way. Yeah, staying intimate as long as possible.
It's good for your health. It's good for your health. But something that you said made me think about this issue of interventions that are offered when you mentioned the doctors coming in. Interventions that are offered that don't address the cultural realities or the social issues that people are facing. And in an earlier webinar, there was a similar theme about, therapists and clinicians being trained a particular way, and that the training is of limited value to the actual folks that you're trying to work with in our Latine community. So is that something else that you think needs attention if you were, I don't know, suggesting to policymakers and program designers, that kind of thing, or even academic programs that train people? What would you say about that?
I would say cultural competency is highly important. It has not been studied enough. In my studies and my research, that's actually what I focus on is in the cultural aspects that pertains to depression and loneliness. And there is a high need of folks who are not just bilingual, for example, in Spanish, but live the culture. It's one thing to just know the language, but to live the culture and really fully understand it. And we do lack that, not just in Connecticut, we lack that all over, and it's something that there are programs out there that can assist in developing even kind of the layperson to focus on that cultural aspect. As a mental health first aider, we tend to look at the individual and kind of start off assessing in a manner of speaking, but in the Spanish language portion of mental health first aid, we look at that cultural portion of it as well. And then the third part of the older adult mental health first aid, we look at that particular segment of life, because each is kind of distinct within it, so you have to really, you really have to be really well versed in not just the language competency portion that you're engaging with a person in the language of their choice. You have to look at the age component, and then you also have to look at that cultural portion of it, of how it really all ties in together. Exactly. If I was to ask my mom about, intimacy, probably not a conversation I would be having, because that's not how we grew up. Right. I would, maybe send her to someone over here, another panelist, but it may not be something I feel comfortable with, which is fine. But having professionals that can engage in those conversations helps the adult child, and it helps the individual to be able to have that separation and ability to go somewhere to a professional, once again, that can support them and guide when necessary.
That's right. That's right. I think that the cultural, the age, and where folks are in their lives are so multi-layered. Like, we are complex human beings, and so the training has to really be the training and development really does need to take all of that into account. The point you made about bilingual isn't enough is also a theme that came up earlier, that bilingual is only one part of it, and really understanding the culture, being of the culture, matters. And clearly there's not enough practitioners of Latine background and heritage. So Francisco, did you want to add anything to that?
Yeah, there's a lot to add with respects to culture competence and not only culture competency, but cultural humility. Because I think there are over 20 countries of Spanish speaking individuals, right? And so my family background is Dominican and Puerto Rican. It's not Mexican, it's not Ecuadorian. And so that's just because I speak Spanish and I'm from, the Caribbean, doesn't mean I truly understand folks from South America or the factors that have contributed to them coming to the United States. And so the cultural competence piece, being able to gain knowledge, being able to understand what's going on is important. And then the humility piece to say, this is still an individual. And although I have the knowledge of this older individual and I understand sort of the normal aging, I understand some of these other factors, but what can this person teach me about their life so that I can have better understanding and then tailor my interventions to their unique needs. And so you need both the cultural competence and the cultural humility to be able to do any of this work, not just mental health work, but also policy development.
Well, let me move our discussion a little further, as we just going back a moment to the connection between the individual and the community, and using volunteerism, using faith-based engagement, using participation in social programs like senior centers, which someday might have to change their name, right? From senior centers to centers for older living, right? And community supports. I'm curious about, like, what's your assessment of the current state of all of that here in our community in Greater New Haven and Connecticut, where there are so many Latine older adults that are not connected to anything. And how do you encourage people to engage? How do you encourage people to go to the senior center or to the group therapy? How and then from your perspective as practitioners, when you see the need for something and you go looking for resources in the community, how often do you come up empty or not enough, insufficient? There are waiting lists, or the programs that are out there don't have anyone that speaks Spanish, no less be culturally competent and human and humble. So long-winded question, but I'd love your thoughts on these. How do you connect?
I think we have some well-established centers for older adults that focus on Spanish language and cultural aspects. Some that I had just that I'm very familiar with is Casa Otoñal in New Haven, Casa Boricua in Meriden, the Norwalk Senior Center South, which are all predominantly Spanish speaking and culturally based programming. I love seeing when Casa Otoñal has had their Bomba Plena programs and people are getting into it and things like that. So there are some great well-established, and by well-established, I'm talking 1970s, established, and they established in communities that are popular communities that are surrounded by that culture. That's generally how a lot of senior centers do work, and especially in larger places like New Haven, or specific areas like Meriden that the community started coming in around the 1940s and ultimately aged upwards, stayed in place, the ones who stayed there, and places like Casa Boricua was established. What those programs need, to be honest, is support and understanding in the legislative part. We need to do a better job in advocating for those type of programs to continue, not just in the Spanish-speaking cultural areas, but all areas that reflect the people that live there. And I know in saying this, it might sound a little like kind of separating people, but I'm not saying to separate. What I'm saying is to have a place where people can have that place not only where they can engage, but they can get the resources once again in their preferred language. And I know in those 3 places that I mentioned, they have social services. Generally, they have their social service workers, coordinators who are bilingual, or sometimes they have several different languages within there. They do provide referrals, and once again, getting people to gain that rapport with them so that they can feel, the individual can feel a bit more comfortable in reaching out to a place like Bridges for mental health services. So it's forming the spaces, making sure that we're engaging our legislators, we're engaging our community advocates, and getting them to say, you know what, this will help this person, but it will help the community greater. And we do need to bring more funds into those places, and we need to have less roadblocks placed there, because duplication of services. We understand that there might be social services in this senior center, but we have this other senior center that is predominantly Spanish speaking, and they also need the funding for it. Just because there's duplication doesn't mean there's duplications of individuals in need. So we have to be those strong advocates for that.
I appreciate that so fully, and also that what you're describing requires coalition building and partnership between all the different providers of services, whether they're direct, clinical practitioners or senior centers or anything else, right? And that as our population ages, right, our Latinx population is aging as well as the rest of the population, because I think that's the point you're making. That we baby boomers, all of us are getting older really fast. And so these are needs that have presented themselves that are not really getting addressed. We have a state area agency on aging. We have an aging commission. We have here in Connecticut a number of, but I think that this real important piece that you're talking about, it's about connections, being strategic, and then putting the funding behind those connections so that they're supported on a sustainable basis. What can philanthropy do about that? So this is Progreso Latino. The funds that Progreso Latino is able to give are relatively small, but well placed. They can help trigger other investments. The Community Foundation makes many grants, many more than the Progreso Latino Fund is able to make. Beside grant making, like what's a role that philanthropy could play in speaking up on behalf of these issues?
I would say be the one that plants a seed for something in the future that you may or may not need. There's a saying about the tree, you plant the tree, it's not shade for you, but shade for another generation. That's how we do this. Be the one that plants a seed. It doesn't have to be a lot, but we have to start somewhere.
I'm right.
Francis,
yes.
Yeah, Francis, you had mentioned baby boomers, and so I was curious as to where do we stand with baby boomers? And what I learned was that in 7 years, all baby boomers will be over 65, and so pretty soon we'll have more older individuals than we have children in this country. And so I think it would be in the same way that we were mindful of embedding mental health services and medical services within school systems, to consider, I think policymakers can consider, can we embed these services within organizations that serve the older population? And then to be mindful that, in 10 years, we're going to have a lot of individuals who are older than 65, and they may need a unique level of support.
That's right. That's right. I think that what it requires is forward thinking, and be the one that plants the seed is a wonderful challenge, right? To philanthropy, to the Community Foundation, and to others, because philanthropy takes that long view is around and tends to be around, and has both the opportunity and the responsibility to think about what's going to be needed down the road. And I love this. In 10 years, there are going to be more of us over 65 than under 65, and we've known that actually for a really long time, and we have not made the investments necessary. So this is an opportunity to do that. But let's go back as we're starting to wrap up a bit. We have about 10 minutes left. I wanted to go back a bit to the individual. And there were some things, I'm looking at my notes from our conversation a couple of weeks ago about, what is it that folks need for healthy aging? Our folks, Latine, older adults who, some of whom may have had, some education and successful careers, and many of whom came from poverty and remain poor today, even. And so what do folks need for healthy aging, whether they're 55 or 75?
Yeah, the three big ones that have been obviously diet and sleep, right? But apart from that, the three big ones have been, maintaining social connections is huge. Keeping your mind active, so learning new things, and so going to an organization that serves older people, and you're learning how to play an instrument, or you're learning a new skill. So keeping your mind active becomes huge in staving off some of the normal aging decline, and then exercising regularly. Those are the three biggest that have been shown to be most effective in promoting healthy aging.
For myself, sorry.
Go ahead.
You can't take a
the only
pause
thing I was going to add is
too
that
long there.
Yeah,
Sorry.
I know, right? I know. The social connections really are mitigate the risk for depression, which is a contributor to heart illness. And so it's a vicious cycle that if folks are lonely, they're more likely to be depressed, they're more likely to experience medical issues. And if we can help older individuals maintain social connections, we can really help them improve their lives as they age.
Mm-hmm. Mm-hmm. Go ahead, Leonora.
So I think for us, in terms of kind of understanding and working towards healthy aging, is we have to kind of teach ourselves to stop our own negative talk. We have to stop talking about what's going to be like for us to get older. Once we're older, it is what it is sometimes, right? But we can carry this baggage of what an older person is supposed to be like. If you are saying, I'm going to be riddled with pain, I'm not going to be able to do the things I enjoy doing, this negative self-talk, this is actually contributing to unhealthy aging. It's going to affect everything from what you end up wanting to do to what you want to eat. It's going to affect everything. I think we talk a little bit about depression, but we see that depression in older adults is not as high as in younger cohorts. The rate of it is really about, I think, when older adults 65 plus, and please correct me if I'm wrong there, Francisco, it was hovered between 5 to 7%. So it's pretty on the low side, and really that is depending on of where they're living. Their living arrangement can contribute to that. Their environment generally can contribute to that. But we see something that does occur. We see the rates of suicide increase as a person ages. So we'll see between 16 to 20 a high rate of suicide, and then it kind of mellows, kind of simmers down a bit, and then it starts to climb again between the ages of 65 to about 74. and sometimes we'll see it again in the next chunk of years. And a lot of that is because of ailments, loss of physical ability, loss of cognitive ability, death of spouse, friends, family, disconnection from life increases that. So what we need to do, whether we're clinicians, professionals, laymen, whatever, community people, family member, is to talk to people about it. If you see a person is no longer thriving in the level where they are, we have to be upfront about it. If they're saying, if there's engagement in negative talk, we have to be out there and say, are you thinking about suicide? Have you, this is such a hard thing for us to want to say, because it's like, oh my gosh, if I say that, it's going to encourage them. No, a person who is thinking that, is thinking that. But we need to be the ones that try to get them to the point where they're actually getting the help they need. And by engaging a person, regardless of age, but engaging this person, we open those doors once again, and we try to get them the help that they truly need, and there's recovery to it. Mental health is something that people can go towards a road of recovery. Just because a person has a mental health issue or illness, or they're in some sort of condition, doesn't mean that they need to completely withdraw from life, but that we could be supportive, that we can be there, and they're reminded that they have people who love them, care for them, and want to see them recover. So
that people can feel better.
absolutely.
I really appreciate this point here about suicide, because that's definitely something we don't talk about. We don't talk about suicide in our community. And we know that it's got prevalence in all the age groups, but we don't talk about it. And so my only question here is, where do you, how you've got the suicide hotline, that kind of thing. That is such a serious, if any of us ever feel like we might want to commit suicide, or are worried about a loved one, an older adult loved one, or anybody else, where do you go? Like, who do you call? Yes, you might say, hey, but where do you go?
So, the number had recently, it used to be a 1-8 something number. It's now simply 988 that a person can reach out to and connect with someone there, whether they are with someone at that moment who needs to go and speak to someone. It's available.
In English or Spanish?
Yes, in all language. It has many languages, but language of person's preference. Encourage a person to use a number. Be the person that dials a number with them. So I'm going to stay in the room with you because I care about you, and I'm going to be here, so that they can even start by picking up the phone or having that first part of it. We have so many of these resources, but we don't talk about in the community, because as someone I noticed in the chat mentioned, we don't talk about Bruno.
Right.
In my last one, I mentioned about that too. We don't. We want to cover it, hide it, put it behind the wall, but we never want to confront it.
Right.
Because it's scary and it's real. But so
what's that number again?
It's 988.
988. Okay. Well,
and for clinicians, I think it's one, being an older white male puts you at the highest risk for suicide. That's still the highest risk of individuals committing suicide. But folks who are experiencing a lot of pain, as clinicians, we really need to be mindful of if pain management isn't well managed. If pain is not well managed, that increases the thoughts of suicide.
Pain can feel unbearable. Yes.
And self-neglect is, although not in one the same, but self-neglect can lead to a person becoming more malnourished and ultimately a failure to thrive, which is a very long way of ending your life, in a matter of speaking, a very
right.
long, cruel way,
Oh yes, my godparents, my father's brother and his wife, who were my godparents, when my uncle died, my aunt became so depressed. She was in her 80s and infirm. She had a bunch of health issues, one of which was diabetes, and she stopped taking her insulin and stopped eating, and really, really deteriorated. And because she was living far away and my cousins weren't there, it took a crisis to realize what was happening, right? But it is, you know, again, that feeling of being disconnected and lonely and in pain and sad, and so that is a form of suicide, actually, long and painful, drawn out, but a form of suicide. So I have not gotten a lot in the Q&A, but a couple of things have come up in the chat, and in the Q&A there was an affirmation about older adults versus senior, like, you know, thumbs up on that. And in the chat, there's a lot of really good references to different organizations that I'm hoping the Community Foundation can capture and put into whatever the final distribution about this program, so that folks can get that. We're at 12:55, and I know that there's a little bit of wrap up that needs to happen. I am so grateful for this conversation, for you and the work that you are doing. And I wish you all, you know, all the health and the strength and continued commitment to it. And then I'm going to pass it over to Liana Garcia from the foundation. Thank you. It's been a pleasure.
Thank you.
Thank you
Thank you.
all. It's just wonderful to have such expertise within the Latino community and to be able to showcase that here with everyone. So I thank you very, very much. I will add to the conversation by saying that there are studies that show that people who donate actually live longer. And so I'd like to tie that into your points about being connected to community, caring about community, social interaction, all of that companionship ties into how we can all age well in a very fulfilling way. So thank you again for this very rich dialogue today. I'm going to ask all of our participants, who I also thank for attending, to take a few minutes to give us some feedback. At the end, you will see a survey pop up. That information is very, very important to us because it helps us continue to provide quality programs like this. I am also going to ask you to all join us on Friday, November 10th from 6 to 10 p.m. for the Progreso Latino Fund's 20th anniversary celebration at Amarantes. You can use the QR code or go onto our website to join us. And I'm going to say, if you enjoy this series of webinars, not just today's, but the other two, I'm going to ask you to support the Progreso Latino Fund so we can continue to provide these programs. And I just want to also add that as part of the 20th anniversary celebration, we're doing a match campaign so that any gift to the fund will be matched dollar for dollar up to $2,000. So I again invite you to go onto our website and please make a contribution. And we are also going to ask you to share your experience and your feedback on social media using the hashtags and the information that you see on your screen. And with that, I thank you all, both our panelists, moderator, and attendees for participating in this very informative program. Have a great afternoon.
So long, everyone.